We don't need to be populist about healthcare. We need to be realistic.
That raises another question, particularly taking advantage of your very international experience. You're originally from the UK, if I remember correctly. You're living in Portugal, you're working in Spain. Do you see big differences? For instance, if you compared the NHS model to the Spanish model, the Portuguese model, and so on, they're quite different in terms of how the national authorities and the national payer works with the healthcare community locally. Do you have any particular lessons that you've drawn from these different environments?
I think we need to have hybrid systems, actually. I think public health is very important. I think we should uphold our public health, but I don't think we should become radical about it. I think it has to change. I think it has to admit that it needs private support and help and be honest about it. And that's a political issue. We don't need to be populist about healthcare. We need to be realistic, and we want. The US model is unsustainable. So how many million people are going to be left out of care? We can't do that. Access to treatments and therapies. If we're looking at all these expensive biologic treatments now, how is that going to happen? Where will the budget for it come? We're 2 years into a pandemic. It's not going away. And we now have millions of people affected by COVID, which isn't even properly recognized yet as a new pathological area. So we've got to be much smarter here about what we're doing in health. Optimize use of health, personalize it, but realistically, segment, group people with similar preferences, priorities, difficulties, disease issues, and tackle the whole spectrum of health in a very different way.